from Drbeen.com. Welcome to one more show. So, we had a good, rich discussion this morning. I wanted to offer you a couple of more tiny videos today. I am actually going to be working on the Luffy channel today. Plus, I have another project that I want to share with you after this talk. So, we will do this talk. I hope we can keep our sanity after looking at these letters. And then I would upload a video afterwards. I would appreciate if you can watch that video as well. It is just 3 minutes after this talk. And then I would do some more changes to it. So we won't do a chit chat today, but I wanted to share this video, this talk, and then I would upload a video. So let's start. So this is a letter that is sent by, this is the organization, Independence Blue Cross. Health insurance plans with Independence Blue Cross. So this is health insurance company addressing a doctor or doctors, talking about how to prescribe to their members. This is what they will do if you are their member. Do not prescribe ivermectin for COVID-19. Dear doctor and or healthcare provider, ivermectin should not be prescribed for COVID-19, and any use for this indication should immediately cease for our members. Essentially, in my opinion here, ivermectin's role, positive, not positive, useful, not useful. What you are seeing here is, if you elevate yourself above the ivermectin itself, you are seeing a healthcare organization telling doctors to stop any thought of off-label usage here. And if this is the case, then there are many other off-label uses as well. And I'm seeing this again and again, that organizations are breaking their own rule to go as an exception here, and then still say we actually abide by our rules of being neutral and being caring. The best example for me, even more intense than this, is American Medical Association. If you look at their positions on hydroxychloroquine or ivermectins, you would see that they break their own rules to give a guidance. And then when it is brought up that, hey, you broke your own rule, they say we abide by, we adhere to our rules, but we would also continue to break the rule here. That is the, what would you call it? I have some words for that. Okay, so ivermectin is not authorized or approved by the US Food and Drug Administration for treatment or prevention of COVID-19 and has not been shown to be safe or effective for these indications. In 2020, so this is a letter addressed, I believe, to many doctors. In 2020, you prescribed ivermectin without evidence of a corresponding approved indication. Our findings are based on Independence Blue Cross Independence claims data. So they're digging in the data. Then they have an asterisk. We acknowledge that claim data can be limited. This could occur from a delayed medical visit claim that includes an approved indication, a claim that is missing the ICD-10 code for an approved indication or an off-label use. My apologies. Give me 1 second. I just want to make sure that these dings do not occur. Okay, back here. Then they say concerns about ivermectin. So this is a drug, this is a healthcare company teaching a doctor about the concerns about ivermectin. The Center for Disease Control and Prevention, CDC, FDA, the American Medical Association, and the American Pharmacists Association have strongly warned against prescribing ivermectin for the prevention or treatment of COVID-19 infection. Strongly warned. The manufacturers of ivermectin, Merck, has stated, and Merck has no standing in this matter. My apologies, something started installing on my machine. Merck really doesn't have a standing. How do they know ivermectin works for COVID or not? And then giving a broad statement and then becoming the lightning rod for others to use them as an example. The manufacturers of ivermectin, Merck, has stated, we do not believe that the data available support the safety and efficacy of ivermectin beyond the doses and population indicated in the regulatory agency approved prescribing information. You realize that nowadays there are drugs and other therapies. The same statement can be actually applied to them as well, and these are being used for COVID-19. The National Institute of Health's COVID-19 treatment guidelines panel has also determined that currently there are insufficient data to recommend ivermectin for COVID-19 treatment. Non-indicated ivermectin use for the prevention or treatment of COVID-19 gives individuals a false sense of protection compared to sitting at home waiting to become blue in the face and going to the hospital. It undermines trust in approved and appropriate COVID-19 prevention and treatment drugs and practices, which, again, if there is a protection, for example, I would agree with this statement here. If a person says, I'm not going to go to the doctor and I'm not going to tell them that I have COVID because I'm taking ivermectin. I have not seen anyone doing that. Actually, I have text messages that people forwarded me where they reached out to their doctor and said, I have cough, or I have this, or I have runny nose. And doctor said, stay at home, take Tylenol or whatever similar medicine. And if you have more symptoms or if you become worried, go to ER. It undermines the trust in approved. Tell me where the trust really is being undermined. Taking large doses of ivermectin is dangerous. Agreed. Taking large dose of any medicine is dangerous, or not even medicine. Taking large dose of anything is dangerous. Recently, there have been increased reports to Poison Control and Emergency Department of overdose on ivermectin. And this is that one, I believe their basis may be that Oklahoma's report where this was really a number that was not even accurate. Maybe they know something more. Clinical effects of ivermectin overdose include GIT symptoms such as nausea, vomiting, and diarrhea. Overdoses are associated with hypertension and neurological effects such as decreased consciousness, confusion, hallucinations, seizures, coma, and death. Ivermectin may potentiate the effects of other drugs that cause central nervous system depression, such as benzodiazepines and barbiturates. It can also interact with anticoagulants. They are correct at the drug interactions, and most of the drugs have drug-drug interactions. And most of the doctors, when they prescribe something, they should look at drug interaction and adjust the doses for either drugs. It's not a practice that is an unknown practice to a doctor, or something that a doctor, at least in the US, will be not careful about, because it's a litigious society. A doctor, if accidentally does something that may not be correct, or knowingly or unknowingly, they can get in trouble. Doctors are very, very careful people. Additional recommendations. Now, this is what the health insurance company is asking a doctor to do. Educate patients about the risks of using ivermectin without a prescription and ingesting ivermectin formulations that are meant for external use, or ivermectin containing products formulated for veterinary use. This is correct. We should talk about it. And ideally, CDC, FDA, NIH should sit down, have a round table conference, have the doctors there, the ones who believe they should use ivermectin or other drugs, and the ones who do not. And the conference could be, it's not just the ivermectin. One could talk about remdesivir in there as well. And there could be doctors who say, I think it works very well. And there could be doctors who say, I do not think it works. Then the data should be there. And then a scholarly, a wise, uh, decent discussion could occur. Patients should immediately seek medical treatment if they have taken any ivermectin or ivermectin containing products and are experiencing symptoms. Encourage patients to get vaccinated against COVID 19 and encourage appropriate masking and respiratory hygiene precautions. This is education to the doctors from the healthcare insurance company. COVID 19 vaccination is safe and effective at preventing infection. I think this statement is now in Omicron world may need to be looked at once more, and protecting against severe disease and death. So I agree with this. Vaccines, severe disease, death, there is protection. And there is no doubt that there is protection. I I really hope that at some point, for the sake of people, there would be healthcare authorities coming together and saying, we understand that there are some issues, there are some side effects, there are some clottings, myocarditis, other things happening. Here is the data, here is our guidance. Let's connect, let's talk about it. So, disease and death from SARS-CoV-2, the virus that causes COVID-19, they're talking to the doctor and they're educating the virus that causes COVID-19, including the Delta variant. Now they'll have to probably readjust according to the Omicron. Then they say next steps. Check this out now. Next step. We will continue to monitor your prescribing behavior and may request to review patient charts. A determination that you have inappropriately prescribed ivermectin could result in several consequences. Check this out, including referral to our fraud and abuse department and or termination of your participation in our network, an action that would be reportable to the National Practitioners Data Bank. If you have questions or require further information, please do this. qualitymanagement@ibx.com. Thank you for your care and service you provide to our members. I think that they could have just skipped that statement after writing such a letter. Sincerely. So this is, I can't read here, but I think this is their quality assurance department. So this is the references they have. These are the letters. So when you go to a doctor and they are not able to even talk about certain things, you can understand the kind of pressures they're under. FDA's letters are going to the insurance, state medical boards and their boards confederation or the federation. So insurance companies are sending these letters. Media is calling names. CDC calls names to their own people. Here is another letter. Currently insufficient data. This is a different letter. Somebody else forwarded it. Currently insufficient data to recommend ivermectin for treatment of COVID-19. Additionally, in February 2021, the manufacturer of Stromectol ivermectin released a statement that discouraged the prescribing of ivermectin. Now, they're not the only manufacturer. Now, ivermectin is manufactured a lot in so many places. Discourage the prescription of ivermectin for COVID-19 due to the lack of safety or efficacy. The iMedic and PPI Medic have identified potential fraud, waste, and abuse patterns associated with ivermectin utilization as outlined below. How much caring to the waste and abuse patterns? I think that we should throw out the off-label laws, and with the current way of things, the way things are, I hope that they become corrected. Otherwise, to me, remember that little joke I made once, that Algorithms will be sent out to the call centers, and patient would just call, or the doctor would call and say, Mr. Call Center person, I have a patient. The computer says diagnosis is this. What is the algorithm I should follow? And that person from the other side would say, you do this, this, and this, and that is the algo. And then they would get some. Anyways, so prescribing, authorizing ivermectin to beneficiaries in state where they are not medical licensed, prescribing authorizing quantities and or days supplies that are not consistent with typical treatment regime, advertising ivermectin to beneficiaries for the treatment and or prevention of COVID-19. CMS encourages plan sponsors to continue to monitor the utilization of ivermectin and ensure that it is being utilized appropriately and safely to protect Medicare beneficiaries. These are the kind of letters that are out there that doctors are receiving. I believe nurses, nurse practitioners, physician assistants, providers. At the same time, I'm sure that pharmacists are receiving these and pharmacies are receiving these. The corporates are already, in my opinion, practicing medicine, which they're not supposed to. When it is, I cannot still forget, and this is a totally non-political statement, this is a doctor's statement. When I heard Don Lemon saying on CNN that those who are not vaccinated, we should leave them behind. One, the insensitivity of that statement, and secondly, a corporate outlet practicing medicine. Here you're seeing more outlets practicing medicine. This is what is happening. And then tell me this, when such things are happening, how would the conspiracy theories not become stronger? Why would people not become upset and angry and then respond in not the most aligned way? So anyways, I had been sitting at these letters for some days. I did not know how to exactly present that because I would talk about Omicron and others, but I wanted to bring that to you to at least share the kind of, and it is, somebody asked me today about the pressures on me. And I said, look at, I mean, as I usually say, I'm a small fry. Look at what is happening to Dr. Paul Marik. Look at what is happening to Corey. Look at what is happening to Madhuri. Look at what is happening to so many others who are sincerely working on things. One can totally agree, disagree, prove somebody is incorrect by mechanisms instead of doing such things. Anyways, so this is where we are at. I'm gonna hang up now. Please stay safe, happy, and healthy. I hope you can continue to stay sane after these kind of letters and their exposure. Please do me a favor, if you like and enjoy and there is some value in these lectures, please like, subscribe, and share. If you don't want to subscribe to not see my videos all the time in your feed, then just like it. That would also bring some videos in your feed, but it would promote the videos too. And if you would like to support this work, there are links in the description. You can buy me a coffee, or you can become a patron, or you can use PayPal. With this, thank you very much. I'm going to hang up. I will not come back for chit chat today. This is the second talk. I'm going to actually upload a video, which is just 3 minutes long video, but it is my attempt at a more polished, decent, short video for you. And we will continue with long and short videos. So I would really request if you can watch it, share it, and then give me your feedback as well. Thank you very much. And wait for another 10-15 minutes for the upload. Bye bye for now.